technical parts of CPR. Open the airway up, get your ear over their mouth, looking at the chest, and you're going to listen, look, and feel to see if they're breathing for 5 to 10 seconds. So just make sure you open the airway like this. If the tongue was blocking the airway, this lifts it off the tongue. Lifts the tongue off the airway. So 1 1,000s, 2 1,000s, 3 1,000s, 4 1,000s, 5 1,000s. You find that they're not breathing, so plug the nose, seal your lips over their mouth, and give 2 slow, normal breaths. So breath, breath.
So you mean an exhale or I'm blowing?
Blow it.
Like from my lungs into...
Yeah.
But you seal your mouth to mouth.
Yeah, seal your mouth.
So it's like...
Yeah. Yeah, on these guys. And then your next step is, if you ever learn to do pulse check, skip the pulse check, go straight to doing compressions now, because the heart is going to shut down after 1 to 15 minutes if the lungs aren't working. So that's why nowadays you just go straight to doing compressions. Okay? So what you want to do is, but I'll show you something. It's good for you guys to learn the pulse check, so we'll do it that way on the internet afterwards. Okay, so what I do to get in position on the chest, to make sure I'm in the midline on the chest bone or the sternum, hand under the underarm, slide your hand across, get to the sternum. And you press down the heel of your palms right there on the chest. So make sure you're in the midline. Okay? Get your shoulders over the victim's body. So if it's a child or an adult, you want them on a hard surface on the floor so that you can do this and go down, come up. Go down, come up, go down, come up as fast as you can 30 times. So 1, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And then breath, breath. So that's another change too. This is as fast as you can go. So you press down, come up. Press down, come up. Okay, so grab a head and just practice opening up the airway. So make sure your fingers are here on the jaw. So they're not down here. And if it's down here, you might suffocate them.
Oh no.
Yeah. So put your fingers here, open the airway, listen to see if they're breathing for 1 1,000s, 2 1,000s, 3 1,000s, 4 1,000s, 5 1,000s. If they are not breathing, plug the nose and give 2 normal breaths. So breath, breath. Okay, and make sure you kind of look sideways a little to make sure those 2 breaths go in. Landmark on the chest, underarm, slide across to the middle.
Whichever side, right? Or I guess it'd be...
At either side.
Underarm
Whatever
is
side
like
is like,
here.
some people go underarm like this and slide it together, so whatever is like best for you.
Okay.
And do they used to say with adult, I don't know if the adult lock the elbows? Is that
Yeah,
still
lock
apply?
the elbows, yeah, you can do that. And locking the elbows makes it last a bit longer if you had to do it for a long time. 5, 6, 7, 8, 9, 10, 12, 13, 14, 20, 21, 29, 30, and then breath, breath, and then you're back on the chest.
It's a really dumb question. Is it going to be as tense as this?
Yeah,
The
hard.
real-
It's
oh.
really hard. Until they throw up, until they wake up, or until EMS arrives. Or if someone can help you do it, you can teach a bystander how to do it and let them start doing compressions also.
Okay.
So just to summarize, we just heard you keep going, you don't stop to check. Okay.
No, never again. You don't stop to check. Unless if they throw up, it's up to you if they check. It's up to you if they check. But don't be surprised, we're going to do a bit different on infants because some infants, especially premature ones, they forget to breathe. You know that, right? So
Yes.
it may happen at home also. Additionally, they're prone to choke. Well, all of them are prone to choke on their spittle, on milk, on whatever. So you're going to have to make sure that you do some things a little bit differently. Before you start doing CPR, you can do something first that's really quick, and we'll do that afterwards. Okay, so everyone's okay with the technical part of CPR? So now there's some safety steps that you want to follow. So like if I come in this room, I look around. If I see anything harmful, I'm going to try and pick up my victim and call 911 with them. Or if I can't move them, I have to leave them and call 911. So hazards such as fire, wire, glass, wild animals. So my next step is I look at my victim's body for any obvious signs of trauma, such as a head trauma, severe bleeding, bluish skin, greenish skin, anything abnormal, I call 911. And they would tell me what to do next. Okay, basically in severe bleeding, they'd ask me to bandage the wound with whatever I could get. Okay, so I look at my victim, I don't see any signs of that. My next step is to try and wake them up. So I tap them, hello, hello, are you awake? Hello, hello, are you awake? Hello, are you awake? And they do not wake up. So they're unconscious. So what I'm going to do is ask someone to go call 911. So hey, you in the black shirt, go call 911. There's an unconscious victim at St. Mike's Hospital. Do you understand? Report back to me. Now I'm back to the technical part. So I open up the airway, get my ear over the mouth, looking, listening, feeling. 1 1,000s, 2 1,000s, 3 1,000s, 4 1,000s, 5 1,000s. Not breathing. Plug the nose, maintain an open airway, and it's breath, breath, landmarking, and I do the 30 compressions and then 2 breaths, and I complete the process until help arrives or they start breathing on their own again. So everyone got that?
So you were breathing for them by doing that?
Yeah, and pumping for them to make
So-
the heart move.
Nothing was different, but from that we just learned except assessing the risks.
Assessing the risk and calling 911.
Okay.
So now the whole scenarios are on the first page of your booklet, so open it up.
Excuse me.
And so there's check 1 where you do the hazards assessment. You also look at your victim for severe injuries. Check 2, you try and wake them up. They don't wake up, which leads to check 3, which is you're going to call 911. And then airway is the open airway. Listen, which is breathing. Listen to see if they're breathing. They're not breathing, give them 2 breaths. Circulation is when you give the 30 compressions.
And
You
if,
blocked their nose. Oh, sorry, you blocked their nose.
and if they are breathing, then everything's good? Or you say
Well,
listen
if
for
they're
the breath?
unconscious and they're not, but they're breathing, you put them in a position. I'll show you that position
Oh, okay.
afterwards. The recovery position, and it's still 911 call because you don't know why they're unconscious on you. Unless you really, really know why they're doing this, you would have to call 911. Any questions?
Well, just you said that premature infants stop breathing sometimes. Does that like stop as they start getting into
Yes.
term?
Yeah. Once
Like-
they start to get their,
Like
it's-
ours are 36 weeks and they're coming home today.
yeah,
So like they're almost term, so it gets better.
it's better. It's better. It's because their brain wasn't ready
Okay.
for breathing on their own. But they should be okay. Because now it's just choking, which affects all babies at any age. Choking on spittle.
So going back to the because mine was also premature, but he's now 39 weeks. Is that like that sleep apnea, like when they stop breathing at night, or is it even during the day?
It can happen. I think when they're feeding them, sometimes it'll happen, but I'm not really certain because I'm not.
Oh, okay.
Yeah, but I've just heard from other parents that it can happen frequently in the beginning, but after a while it stops.
So it's something I would notice.
Yeah, but most parents are complaining about the choking on liquids.
Yeah.
So choking on liquids and even just the beginning stages of that is with the coughing.
Yeah, lots of like trying to clear his throat.
Yeah,
And
there's
like,
there
it
could
seems
be,
like he's trying to get a
Yeah.
nice big breath. But
Yeah.
It's like kind of a gagging thing.
there's could be mucus in there too.
Okay.
So in that case, there's a procedure you can do, and it's not it won't cause them any harm by doing it.
Are you showing me that?
Yeah, I'll show you. Okay, so let's slide. So any questions so far? Okay, so let's practice it on babies. We'll get back to the adult. Let's get into babies. So this one I'll try and slow down as I'm talking and explain it. What do you do? Okay. Okay, so the differences with infants are you're not going to hyperextend the neck when you try and give them a breath. You're just very gently lifting the head back up. So just very gently lift the chin up ever so slightly. Because if you pull it all the way back, that means you could close the airway again or cause some neck damage. So you just go through the same steps. You come in the room, air check, look at the infant. No signs of severe injuries. Try to wake them up. Are you awake? Do not wake up. Ask someone to call 911. And then your next step is to open the airway. Listen to see if they're breathing, same as adults and children. So 1 1,000s, 2 1,000s, 3 1,000s, 4 1,000s, 5 1,000s. Not breathing. And with adults, you gave them a regular breath. With infants, it's a short breath, a short